I'm Dr. Stephen Smith from Smith Facial Plastics, and a common question is, does a facelift settle? There have been lots of famous folks that have had facelifts in recent months and years that have been talked about, and one of the questions is, why doesn't that lift look the same early on as it does later? And when you think about lifting procedures, you have to understand that it's a repositioning, if it's done the right way, of deeper structural tissues, which include muscle. And we also have to remember that the neck is an area of movement, and in order for the neck to move, the skin has to have some degree of elasticity. And as we age, that skin doesn't have as much elastin, and so it doesn't always just snap right back. So we would expect the result to settle a bit and change, not always in a positive way. Sometimes it is a positive way if somebody's been overcorrected with a facelift procedure. The other consideration is that early on, the patient is going to have a certain degree of swelling. We learn early in medical school that wound healing physiology, that full healing of a surgery typically takes up to a year. So early on we'll have a fair amount of swelling, and swelling is a youthful sort of appearance. So the fuller the face, the more youthful and possibly the more attractive that early result is. So facelifts do settle over time, but very slowly, and those are things to consider if you're exploring facial rejuvenation surgery.